I'm Dr. Peter Simone. I'm a physician here at Ilumin. I've been here for almost 3 years now, and I do general ophthalmology, cataract surgery, refractive surgery, and oculoplastic surgery. So I originally got interested in ophthalmology because my dad was an ophthalmologist. And so I remember when I was a little kid seeing like little snippets of surgeries on VHS tapes, and then just kind of going to his office over the years, seeing the kind of interaction with patients and how appreciative patients were getting their sight fixed. So that's how I originally got interested in becoming an ophthalmologist. Then in med school, I was considering maybe a couple other specialties, but kind of after testing things out, realized that ophthalmology was what I really liked. I think the most rewarding thing about ophthalmology is just being able to give patients the best vision possible, and at least maintain vision as best as you can in certain situations, but in a lot of situations even improve it and get patients a lot of times seeing better than they ever imagined they could. So the vast majority of people are candidates for some sort of refractive surgery, whether it's LASIK or something else. There are rare cases where there may not be something right away for patients, but almost anyone who wears contacts or glasses is a candidate for LASIK or some other type of refractive surgery. And especially people with really high prescriptions who've not been able to see anything since they were little kids, they are very excited that first day when they come back into the office and they're reading the 20/20 line. So for refractive surgery, we can see anyone over the age of 18. LASIK is approved for anyone 18 and over. Most people reach what's called ocular maturity, where their eye stops growing kind of early 20s. So most people, we kind of wait until early 20s before considering doing surgery, but there could be situations where you'd be eligible for something before then. And basically anyone from about, like I said, early 20s up to around 40s to 50s would be eligible for LASIK or something similar to LASIK. People that get kind of into 40s and 50s and beyond would be eligible for other types of surgery, such as cataract surgery or lens replacement surgeries. So for people coming in to get LASIK, basically on your first visit, we get a whole battery of tests done on you to measure your eye, make sure you're a good candidate for LASIK, or perhaps you'd be a candidate for something else. After that, on the day of surgery, it takes about 10 minutes to get both eyes done, so pretty quick. Most people's eyes are pretty sore for a few hours afterwards, so I always tell you just to kind of go home, take a nap, keep your eyes closed, and later that evening they're feeling a lot better. Most people are seeing really well the next day. Most people are seeing the 20/20 line or better. Some people can take a little bit longer, but the majority, everything's doing great that next day. We keep you on some medicated drops for a week. We have you use artificial tears frequently for the first few days, because most people's eyes feel pretty dry afterwards, and that gets better and better over time. Then we typically see about a month out, and then a few months after that.